So now that Obamacare is the law of the land, how does it compare with other countries' healthcare plans? That's a question I posed to Devon Herrick, an expert on 21st century medicine at the National Center for Policy Analysis.
Well, there's a variety of different models. Many of them, well, for example, Canada has a single payer system where you really cannot have private health insurance. It's all paid through taxation, taxes, and the government essentially has a monopoly or a monopsony on the provision of health care, whereas other countries, say Britain, New Zealand, Australia, and many other countries in Europe, have a mixed system where there is a public system, but people who want to can go outside and buy private health insurance. So for the most part, most of the developed countries have some hybrid of both public and private health insurance. But I think the reason why it's not discussed seriously in the United States is because Americans have come really to enjoy their private health insurance for the most part. I think we tend to like the idea of a little bit of choice in the marketplace and deciding, what amenities we have. And so it's then if you look at it again, a lot of Americans tend to think of single payer as more of what you might call a socialized healthcare system. And the word socialized has a little bit of a negative connotation to a lot of Americans, and they're a little bit leery of that.
Okay, let's look at costs here in the United States. And I've been looking at some figures here. The United States spends a little over $8,200 per person per year on healthcare. And that is 2.5 times as much as many other developing countries, or developed countries rather, including countries like France, Sweden, and the United Kingdom. Why are U.S. costs so high?
Well, we have very little cost control, for one thing. There is, of course, our private health insurance system, as well as the public systems like Medicare and Medicaid, tend to try to make health care relatively inexpensive at the point of service. Patients have, very little cost sharing, and we tend to pay a lot, we tend to get a lot, and so in a way, because of our per capita income, we do demand more and we pay a lot more for that, but we don't really have appropriate incentives for people to watch what they spend.
Okay, so we're going to have to leave it there. Thanks for joining us.
Well, thanks for having me.